case, 62-year-old female. So for some reason, this lady couldn't get an ultrasound, and they were for discomfort, both transabdominal and endovaginal. She refused. And so they ended up getting a CT because they were desperate. Right, she had postmenopausal bleeding. So I'll start here. So maybe people can say what they see. Put some arrows, obviously, but so
there's a right adnexal mass with solid components, and then maybe a normal left ovary.
So yeah, so the lady is 62. The left ovary, correct, does not appear to have a mass, but it's kind of juicy looking. Okay, anything else on this? The
endometrium looks abnormal.
Yeah. So the endometrium is abnormal for a patient of this age who's postmenopausal. Here I'm just showing you that the gonadal vasculature is leading to this tumor, which tells us that it's ovarian in nature. Okay, and then I'll show you, it's already said, endometrium is abnormal. A couple of things. Not only is it distended, heterogeneous, you can tell that there's enhancing components internally. And then on the axial, you could see something that looks almost polypoid. Okay, so what we have is a right ovarian mass in existence with, or in association with an endometrial abnormality, both enhancing components and potentially a polyp. So any thoughts about this?
We've got chats in. People think ovarian metastases, like Krukenberg to the ovary, and endometrioid carcinoma.
Yeah.
Another, Omar, my resident, said granulosa cell tumor.
Yay, Omar.
Go, Emory.
That's awesome. Okay, yeah, so this is an adult, so 62, adult granulosa cell tumor with endometrial hyperplasia and polyp in this case. So a granulosa cell tumors, they're a type of sex cord or stromal ovarian tumors, about 5% of all ovarian tumors. The difference in these is that they're hormonally active, and so they secrete estrogen, which is one of the main things. They secrete other stuff, but estrogen is important in this case because the secreting estrogen causes what we observe in the endometrium. So it could be hyperplasia, it could be polyps, it could be carcinoma, and up to 15% of the cases have endometrial carcinoma associated with them. There is a juvenile form. They look identical, but they occur in young patients, and that form is associated with radiology favorite, Maffucci syndrome. So for those of you who are going to be writing the exam, so multiple enchondromas, as you remember, and soft tissue hemangiomas. That's all I have.
That was awesome. So Alina is
great case.
I got a message. She's the chief fellow at Beth Israel Deaconess Medical Center in Boston. Did a great job. And the case was clinched by our future abdominal fellow, Omar, who's at Emory.
Omar.
Awesome job, guys.